For many years, people working in physical rehabilitation and movement science across different countries have observed the same pattern again and again. Bodies weaken with age, not suddenly, but quietly. Strength fades, balance becomes less reliable. Movements that once felt automatic begin to require effort. Yet despite decades of real-world observation, a very simple message keeps getting repeated online. Walking is enough. You hear it from fitness apps, from tech-driven wellness startups, from influencers who have never worked with people over 75. The idea sounds comforting. Just keep walking. No resistance, no strength work, no power, just steps. But when you look closely at how the human body actually works after 75, this message begins to fall apart. Walking is valuable, but walking alone cannot rebuild muscle that has already weakened. Walking does not train fast reactions needed to prevent a fall. Walking does not load the bones enough to help them stay strong. And walking barely challenges the stabilizing muscles that keep you upright when something unexpected happens. These are not opinions. They are conclusions drawn from decades of rehabilitation outcomes and movement research across multiple countries. That's why groups of experienced rehabilitation specialists, movement researchers, and aging-focused clinicians began comparing notes. They reviewed hundreds of studies. They examined recovery programs from Europe, Asia, and North America. They tested hundreds of exercises used in senior rehab settings. Most movements helped a little. Some did almost nothing. But a very small group stood out. 5 movements consistently helped older adults restore usable strength, stability, and confidence, even well past the age of 75. Today, I want to share those 5 movements with you, not to replace walking, but to fill the critical gaps that walking leaves behind. And stay with me, because number 2 showed faster strength recovery than almost anything tested over decades of observation. Before we begin, let me ask you a simple question. How old are you right now? Share it in the comments. We read and reply thoughtfully. Now let's begin with number 5. A movement almost no one practices, but one that wakes up balance in a way walking never does. Movement number 5, heel-to-toe walking. This movement looks simple, but it targets something that quietly weakens after 75, your body's internal sense of position. This system helps you know where your feet are without looking. It's what allows you to step over objects, walk in dim light, or stay upright on uneven ground. With age, those signals become less precise. Your brain receives less accurate information from your feet and ankles. Heel-to-toe walking forces that communication to sharpen again. You place one foot directly in front of the other, heel touching toes, with each step. This narrow base of support challenges your balance system in a way normal walking does not. To do it safely, stand near a wall or counter. Keep your posture tall. Focus your eyes on a point ahead. Move slowly and deliberately. Take about 20 steps. Do this once or twice a day. People who practice this regularly often report feeling more confident in crowded spaces and on uneven surfaces. As you improve, gentle head turns or brief eye-closed steps can increase the challenge. This movement helps reconnect your feet and brain, something flat, repetitive walking does not train. Now let's move to number 4, which addresses independence directly. Movement number 4, chair squats. One of the strongest predictors of long-term independence is the ability to stand up from a chair without assistance. This single action affects getting out of bed, standing from the toilet, rising from a car, leaving a restaurant seat. After 75, the muscles responsible for this movement weaken quickly if not trained. Chair squats are powerful because they train exactly what daily life demands. To perform them, sit on a sturdy chair, feet flat, hip-width apart, lean slightly forward, push through your heels to stand, pause briefly, lower yourself slowly back down. The slow lowering phase is especially important. Start with assistance if needed. Over time, reduce hand support. Many older adults who walk daily still struggle with this movement. and that struggle often leads to loss of confidence and unnecessary dependence. Practicing chair squats restores strength where it matters most. When people think about balance, they usually focus on their feet or their knees, but in reality, the hips are the control center. Your hips determine how quickly you can recover if you stumble. They allow you to step sideways, rotate, and catch yourself before a fall happens. As we age, hip mobility quietly decreases, and the small stabilizing muscles around the hip joint weaken even faster than the large muscles you use for walking. This creates a dangerous situation. You may feel fine walking forward on flat ground, but the moment you are pushed slightly to the side, turn too quickly, or step on an uneven surface, your body cannot respond fast enough. Standing hip circles address this problem directly. Here's how to do them safely. Stand next to a wall or sturdy chair. Lightly touch it with one hand for balance. Lift your outside leg so your knee comes up toward your chest. Now slowly move that knee in a wide circle. Forward, out to the side, behind you, and back to the starting position. Make the movement slow and controlled. Do 5 circles in one direction, then 5 circles in the opposite direction. Switch legs and repeat. The goal is not speed. The goal is control and range. People who practice this movement regularly often notice better side-to-side stability, fewer near misses when they trip, smoother turns while walking. This exercise strengthens the muscles your body relies on when something unexpected happens. Walking forward does not train this. Hip circles do. Do them once in the morning and once in the evening if possible. Now let's move to number 2, an exercise that surprises many people because it requires almost no visible movement at all. Movement number 2, isometric wall push. This is where many older adults experience a breakthrough. Isometric exercises involve creating force without movement. You push, but nothing moves. This type of effort is especially valuable later in life because it places very little stress on joints, allows you to generate strength safely, improves how quickly muscles activate. That last point matters more than most people realize. When you start to lose balance, you don't need slow strength. You need fast strength, the ability to generate force immediately. The wall push trains exactly that. Here's how to do it. Stand facing a wall at arm's length. Place your palms flat against the wall at shoulder height. Keep your body in a straight line from head to heels. Now push into the wall as firmly as you can. Hold that effort for 10 to 15 seconds. Breathe normally, then relax. Repeat this 3 to 5 times. You should feel your core engage, your shoulders and chest working, your legs anchoring you to the floor. This exercise teaches your muscles to fire together as a unit. That coordination is exactly what helps you brace yourself if you stumble or need to grab support. You can adjust the intensity easily. Push harder for more challenge. Ease off if you're just starting. Some people do this against a countertop or desk instead of a wall. The important thing is that the surface does not move. Many older adults report feeling more stable and confident after just a few weeks of consistent practice. And now we come to number 1, the most important movement of all. The one that research repeatedly shows has the strongest connection to fall prevention and long-term independence. Movement number 1, single leg stance. This is the most important exercise for anyone over 75. And the reason is simple. Every fall begins on one leg. Most people don't realize this, but walking itself is a series of single leg balances. Each step places your entire body weight on one leg, even if only for a brief moment. The problem is this: that moment is too short to actually train balance. So you can walk every day and still have dangerously poor single leg stability. Orthopedic surgeons see this constantly. Patients who walk miles a day, patients who feel active, yet they cannot stand on one leg for more than a few seconds. Those are the people who fall while reaching for something, stepping over a curb, turning too quickly, standing on uneven ground. The research on this is very clear. Large long-term studies show that the inability to stand on one leg for just 10 seconds is associated with significantly higher fall risk, increased injury rates, and higher overall mortality. Not because standing on one leg is magical, but because it reflects how well your balance system, hips, ankles, and nervous system work together. Here's how to do it safely. Stand near a wall, counter, or sturdy chair. Lift one foot just slightly off the ground. You don't need to raise it high. Focus on staying tall and steady. Try not to grip the floor with your toes. Let your ankle, hip, and core do the work. Hold for 20 to 30 seconds. Switch legs. Do this 3 times per day if possible. Many people build it into daily habits. While brushing teeth, while waiting for the kettle, while standing at the counter. Consistency matters more than perfection. As you improve, you can make it more challenging. Turn your head side to side. Close your eyes briefly. Stand on a folded towel. Each progression strengthens your balance system in a deeper way. This one movement trains balance, proprioception, hip stability, ankle strength, core control. No walking routine can replace it. Final perspective. Walking is good. You should keep walking. But walking alone is not enough after 75. It does not. Rebuild lost muscle, train fast reactions, maintain hip mobility, protect against sudden balance loss. These 5 exercises fill the gaps walking leaves behind. And the good news is this: they take less than 15 minutes per day combined. No gym, no machines, no complicated routines. Just simple movements that target what actually declines with age. If you take only one thing from this video, let it be this: balance is not something you hope for. It's something you train. Start where you are, do what you can, and build slowly. Your future independence depends on it. Closing question, CTA. Now, we want to hear from you. Which one of these exercises feels the most challenging for you right now? And which one are you going to start with today? Share your thoughts in the comments. We read and reply personally. Thank you for watching.